Thank you all for joining us today. I am Jennifer with BetterHelp, and I just want to give you a friendly reminder that you have access to one-on-one therapy, classes, and group support on the BetterHelp platform. And with this, you can do this over the phone. You can go for a walk, even with your therapist, if you want to do that. But we highly recommend the video chats as well. It's nice to just have a one-on-one, face-to-face conversation with your therapist. And in addition to the one-on-one chats, the classes we highly recommend, even if you can't attend during the scheduled time, go ahead and sign up anyway, and then it will send you a recording of the class to watch within 7 days. There's over 80 different topics on there, and it's so nice to get different perspectives from different therapists and just be involved in those sessions. And then group sessions are also really nice to join with a max of 18 people that are peer-led groups. And then it's also on topics that are familiar to what you're going through. And so it's nice to talk it over with people. Maybe it's anxiety, just grief, anything that it relates to you. It's nice to have those conversations with other people. And then journaling, I also recommend not only for self-reflection, but for to be able to share with your therapist. And then that way they can just kind of get to know you on a deeper level. So I definitely recommend checking out the other aspects of the platform in addition to the one-on-one sessions. But with that, I would love to highlight a few things about Corey here. His expertise stems in the treatment and management of co-occurring disorders, which includes experience in working with low motivation, self-esteem, life adjustments, trauma-related difficulties, anxiety and depression, substance use difficulties, as well as aspects of various mood and personality disorders. His approaches to counseling are grounded in holistic wellness in theory, and he's a very kind and thoughtful person. So with that, I will turn it over to Corey.
Thanks, Jennifer and Casey, and hello, everyone. Happy New Year. We've made it. It's 2026. I'm still trying to adjust to it. Probably you are too. So I do appreciate the opportunity. We appreciate the opportunity to bring in the new year with an important topic, especially with your BetterHelp perks in finding your therapist fits. So I'm hopeful that this conversation fares well. And as you'll see, if you come to any of my classes, I do about 50 classes with BetterHelp in a wide array of topics. I'm a really interactive presenter. So I know some may have some stage fright. And if you are so bold and you feel so obliged to unmute and talk with me, I'd love the opportunity. You're not interrupting me, but alas, feel free, if not, to default to the chat pod. And as Jennifer always does, thank you, Jennifer, in helping with moderation. I'm in between screens, so I do have my message pane up, and I'll look at that periodically if we do have some questions pop in. But if you'd like your question answered anonymously, Jennifer has posted a link you can find in the in-call messages pane. We'll have about 10 minutes at the end for some Q&A if you prefer to remain anonymous. Whatever preferential for you, I'll meet you where you're at, which is an important tenet of finding your therapist fit, might I add, a therapist that meets you where you're at, which we'll be looking at a bit more here as we get going. So you've decided to go to therapy. Stellar, right? As is the case for many folks, obviously, especially if you've never been to therapy before, you have a lot of questions. There's a lot of anxiety, I'm sure, angst. What do I even ask for? How do I know a therapist is the right fit for me? What's the differences between talk therapy and behavioral therapy, right? Which we can most definitely address today, as well as any specific questions, again, should we have them regarding this. But alas, whatever you decide in regards to your therapy pursuits, generally speaking, as you can read, it's a life-changing experience. And frankly, everyone deserves a safe space, as you can read, to be seen and heard. There's numerous perks associated with talk therapy, which we'll look at. But one said perk I've heard over my years, without revealing identifying info, as I'm bound by HIPAA, folks feel the benefits continue beyond therapy, one, and two, during therapy, they being clients, like to have neutral, unbiased parties. That's something I've heard in my over 10 years of providing therapy. It's just nice, quote unquote, folks will say, to have someone that's not affiliated with my situation, someone of whom's not affiliated with biases or what have you. And also, while I'm on that point, I just happen to think of this, Since we as therapists are bound by HIPAA, even with employee perks and packaging, we do not have privileges to communicate with anyone without your consent. So it's that added layer of confidentiality, with some exceptions. You know, you've already heard them: trigger warning, self-directed violence, or threats of harming others, or court mandates. Sure, but alas, those are 1% sort of situations. So generally speaking, it gives you that privacy, that anonymity, and by proxy, the ability to have a safe space to be seen and heard. So if I may here, whether or not you share this in the chat pod, I'm hopeful that you at least take a moment here, as we can see over the right, to think about why you've decided to try therapy if you're what we call pre-contemplative or contemplative. You've learned your employer offers BetterHelp as an employee assistance package. You've been considering, so feel free to kind of reflect and ponder on that now and throughout our presentation. And if you'd be willing to share in the chat pod, again, feel free to pop that in. I'd love to reference some points should they come in. But it's a great question to start asking ourselves, because as I teach in my boundaries coursework, especially that you'll see on BetterHelp, having a why gives us the how. So if you know why you're wanting to go to therapy, improving on relational endeavors, coping skills, anxiety, depression management, mood fluctuation, vocational endeavors, I don't know, right? That gives you the how. Okay, how can I go about as we'll look at, finding a therapist of whom specializes in these areas, of whom has a knowledge base in a certain modality, as we'll also be looking at here too. And that's what I love about being a therapist personally, is there's a lot of diversity in the therapy realm. We have what are called, what I am, licensed clinical mental health counselors. We have psychologists, psychiatrists, social workers, family therapists. So we all do similar work, but our natures and scopes may vary given what the client may be looking for, which again, should we have specific questions on, I'd be more than happy to address. So some things to consider before we start here. As we can read, if you don't mind me reading this, the great thing about therapy is that it can be customizable to your preference. While all therapists pursue the therapeutic relationship in varying ways, a common trend amongst the approaches is to establish what we call rapport. Rapport setting is very important in the therapeutic relationship. A part of it, I'll just speak from my clinical lens, if that's okay, just give you a reference. I'm a very collaborative, together, let's find solutions sort of therapist. Others may be a bit more what's called directive. Hey, I would like to take the lead and guide most of the conversation, getting to know you. Others use what's called a laissez-faire style, completely hands off. Not to be too cliche or Freudian here. You lead the way. You tell me what you're wanting here while I actively listen. So notice even in that example, a lot of people don't initially consider that. What's a therapeutic style that I yearn for? And as you'll see when you use your benefits here with BetterHelp, you'll complete a questionnaire, which is used, which I'd highly recommend you complete the questionnaire thoroughly, which is used by BetterHelp and the algorithmic data to pair you with the therapist available in your area of whom closely meets that criterion, right? Which again, we'll be looking at some of these more specifically here in a second. Numerous types of therapy, and some things to consider too is very similar to that of, for anybody that likes working out. I love working out, but as you know, if you work out, working out's great, right? But if you're not clear as to why you're working out, you can become a bit aloof as to how to go about in working out. Am I right? Because with working out, just to use that briefly, we have weight training, functional strength training, traditional strength training, cardio related trainings like HIIT trainings or steady state cardio. You have yoga, Pilates, you get my gist here. Those all can produce varying results, right? So if I'm not really clear on why I'm wanting to do it and how that may lead to feeding my why, you can see how this gets really murky really quick. So I'll ask, kind of keep that in mind too, as per the initial question, your reasons for considering starting therapy. And per my reason, I should say, excuse me, how does that lead into the styles of therapy available, and what I'd like to see in my therapeutic endeavors. So we'll talk a little bit about these in further detail here. And you'll have to forgive me. I can get kind of nerdy with this stuff. Counseling theory is one of my favorite things to teach. I have experience teaching as an adjunct professor to aspiring mental health students, and I'm a supervisor for associate level mental health practitioners. So you have to forgive me. I get really nerdy teaching this. So if I get too nerdy on you, just let me know. But one of the more common styles of therapy, many of us here have likely heard it. It's our first point. CBT, also known as cognitive behavioral therapy. If you come to my classes, I have a numerous amount of classes on CBT. It's one of my specialties. CBT, as I'd mentioned, is a very solution-focused form of psychotherapy. It was developed by Dr. Aaron Beck from the University of Pennsylvania back in the mid-60s. And it essentially helps us to build mindful awareness, which, if you don't know, I'm sure you've heard of mindfulness, but what it means in behavioral terms is the observation of the present moments, devoid of meaning and judgment. So when you're mindfully aware of thoughts, of which, for instance, may be negative, irrational, exaggerated, you can recognize the impact that these thoughts have on your thinking, as well, on your emotions, as well as your behaviors. And something I get kind of gripey about, if you don't mind me saying this here, contrary to popular belief, and you may even think this here today or have heard it, CBT is not about thinking positively all the time. It's not toxic positive. It's not let's put rose-colored glasses on and be okay with everything. It's not what it is. It's observing without judgment a thought that may be exaggerated, anxious, et cetera, that's not necessarily reasonable or accurate, so that we can use what we call in CBT speak reframing techniques to view the thought as more sensible, reasonable, and logical. Maybe an example would be helpful. I hope you don't mind. Let's say I have the thought, ugh, it's Monday, today's going to suck. I'll just be matter of fact with you. But if you've had that thought, no judgment. We teach in mindfulness, when you observe your judgment, don't judge your judgment. Right? But CBT would be like, okay, I had the thought, ugh, it's Monday, today is going to suck. Okay, what does that do to my emotions? Well, imaginably, and hopefully you give me a head nod here if you can relate to this, imaginably it makes us feel kind of crummy. It would for me, right? You feel down, you kind of lose motivation, you feel maybe anxious or uneasy, which can lead to maladaptive behaviors, procrastination, avoidant behaviors. In severe cases, increases in absenteeism. Hence why your entity wants to take care of you and your mental health and offering EAP package with BetterHelp, right? So you can recognize, hey, are there proponents with, say, work, for instance, that lead to maladaptive emotions or behaviors? And I like the choice of word here, interrogating and uprooting negative or irrational beliefs. So I often adopt the role, as you'll see if you come to my classes, of encourage clients to adopt the role of a detective. Right, that's our role in CBT, and I hope you like that. You're getting your magnifying glass out and you're investigating. We call it in some forms of behavioral therapy checking the facts. You're just getting your magnifying glass out. Is this based on facts, feelings, or both? Am I attempting to interpret this without all the evidence? What am I not considering in this situation? What would a friend say about this? Which can reformulate that initial thought to, well, I might not be thrilled to come to work today, but as I was talking with Jennifer and some folks at the onset of the call, it's just a nice change of pace to get back in the groove of things. To say, hey, the holidays were the holidays, but I get the opportunity to get back into the routine. Notice that's not necessarily toxic positive. It's reasonable and allows us, if we can imagine, it may not entirely quell that, say, depression or dread entirely, but it lessens it. And dare I say, sometimes it promotes a brand new emotion. I told you I get nerdy on this, so I digress. All this and more you can learn about in some of my courses. And if you're interested in this as a style of therapy, do note there's numerous therapists that provide cognitive behavioral therapy as an option. Next, we have narrative and art therapies. These are more expressive forms of therapy. As we can see here in the middle point, narrative therapy, if you don't mind me reading, is a form of counseling that views people as separate from their problems and destructive behaviors. Narrative therapies have caught a bit of a second wind in the last 5 to 10 years, and I argue this is largely due to social media, which I do like to see. Right, it gives people awareness and insights as to the abilities and of being able to rewrite their stories. Though not entirely correlative to narrative therapy, this is a part of what we call psychodynamic approaches. I'm sure you've heard of them abound if you're on social media. Inner child work, shadow work, right? So there's some correlates there with the narrative in rewriting the story, right? And as you may even be experiencing now, it's a very invigorating style of therapy. Wait, Corey, you mean I get to rewrite the story in therapy? Yeah, you do. You get to grieve on what it is maybe you had not received in your formative years, acknowledge the impacts maybe it's had on you presently, and work to release those energies that no longer serve you. Not to sound too cliche, I'm as a therapist, but it's rewriting, it's reformulating the story. What do I want the narrative to be? I'll quote here Dr. Marsha Linehan, the founder of dialectical behavior therapy, which we may or may not be getting to here, but she says, and I love this, ties into narrative therapy, life can still be worth living even if it involves pain, which is quite sentimental. And so if we can still live a life despite our life having some pain, by proxy, we're able to rewrite the story amidst the pain, right? It's not to sound too extremist there, but yeah, there's pain associated with life endeavors. Yes, life doesn't always go how we would like it, but alas, we can utilize the narrative, i.e. the things we tell ourselves, to purvey and orchestrate that future maybe that we want for ourselves. Next is art therapy. There's all sorts of expressive therapies. You'll notice we have numerous therapists with BetterHelp that utilize art therapies. Admittedly, art therapy is not my niche or forte, but rest assured, there's numerous therapists once you utilize your BetterHelp perks, if you're interested in this, that can incorporate it. A lot of my peers over the years and some of my affiliates love art therapies, sculpting, coloring, collages. A lot of my supervisees use art therapies because these expressive approaches allow you, as you can see here in the middle, to examine the psychological and emotional undertones via art. And some even, and again, admittedly, this isn't my forte, so I don't want to speak too outside of my scope of practice, but some folks are even credentialed as art therapists. I'm credentialed as a certified DBT therapist. I have specific training there. That's very similar in the art therapy realm, a certified art therapist. This means they go through additional training via continuing ed they're trained essentially, those being art therapists, to interpret here at the bottom, the nonverbal messages, symbols, and metaphors that are often found in these art forms. And my apologies, yeah, that's what I meant to do there. Yeah, so that's just a handful of modalities, many, many more to choose from, which again, if you'd like to utilize the chat or the anonymous Q&A, we'll get to that in our last 10 minutes. I'd love to answer more specific questions regarding the types of therapy available to you. Now, a few modalities of therapy to be considered. Jennifer talked with you all about the modalities that BetterHelp offers. Unfortunately, BetterHelp does not offer in-person services, but outside of entities like BetterHelp, there's most definitely in-person providers, which we will discuss the pros and cons of each here, if that's okay. In-person can be a great modality, as it's largely, before I put the cart ahead of the horse here and get tangential, it's largely preferential. Recent research has shown that was conducted over the COVID-19 pandemic that a large majority of individuals find virtual therapy to be just as effective as in person. So the effects are essentially the same. It's largely preferential. I say that because for folks that like to consider in person, they have the preference of, well, I just like being in the presence of somebody else. I like seeing their whole interactions, what have you, which you do with some virtual endeavors to a degree, which we'll talk about here. But again, the preference of, I kind of like the whole rigmarole, if you will, getting in my car, driving to an office, completing paperwork, being called back to an office or what have you, something like that. Others, as you can imagine, don't really, and that's okay, right? That can be really daunting, and admittedly, a big reason why folks don't seek therapy, because it's intimidating for some, right? Admittedly. I'm comfortable enough sharing. As a therapist, I've been involved in my personal therapy throughout my life, and I can attest the first time going to an in-person therapist is very intimidating, right? You know, what's the waiting room going to look like? What am I going to be expected of? But it has its perks. It can be very rewarding, which leads to the services BetterHelp offers here, if I may here, virtual, phone, and live chat. That's what Jennifer was walking you all through at the onset of our presentation. So virtual, like what we're doing here, video calls, are a great modality. They're nice because you can do a lot of the rigmarole that I alluded to prior to your first visit, because also, not to be too redundant of what Jennifer had shared with you all, you have access to a messenger space, meaning that you can message your therapist asynchronously prior to your first live visit. So as you can imagine, you can provide some information in the messenger space, also bound by HIPAA. The messenger space and the therapy spaces are confidential and encrypted. So you can provide your therapist with some lead up information, some additional paperwork if need to, and what have you. And as you'll see when you use BetterHelp, it's all in one place. You have a therapy page. So you'll be prompted to log into a virtual room similar to like what we are on Google Meet. And you have a phone, or excuse me, a video conversation. Sessions can be in the upwards 30, 45 minutes. And again, largely preferential to what you want. BetterHelp also offers phone and live chat. Some find that an initial consult or two, or even again preferential phone visit is better for them. I'll share here for neurodivergent populations, research shows that some neurodivergent individuals like phone visits because they don't have the anxieties of eye contact, say if they were to have in a virtual visit. It's not to say one supersedes the other or what have you. They all have their perks. But again, back to finding our right therapist fit. Does my therapist offer phone modalities? Admittedly, I hate to be the bearer of bad news, some licensure boards require the clinician to conduct only video visits. You can inquire with your therapist. That's largely dependent on the therapist licensure board. Each state varies on that. Some require a virtual, others do not. I'm licensed in North Carolina and Oregon, and those states do not have a preference. You can do either or. So again, just an added side to what to talk about, or perhaps your therapist will address with you. But if they're afforded opportunities or provide that as an option, phone can most definitely, in general sense, alleviate a lot of that initial anxiety leading up to the call. And BetterHelp also has live chats, meaning similar to that of the messenger space, you are in a real time. Everybody remember AIM, instant messengers? It's essentially like that. I'm showing my age. I'm a millennial if you can't tell here. But yeah, AIM, for folks that can relate to that, it's very similar to that, to where you're synchronously communicating via text with your therapist. So again, a lot of this is, not to be squeaky wheel on this, preferential. So the questions we'll potentially have through the remainder today or at our Q&A, which again, I'd encourage you, if you haven't already submitted questions, we can address them anonymously on your behalf in the last 10 minutes or so. I'd love to. Love an opportunity to hear from you all. But we can get to some of those more specific questions should we have them. What might be a modality for me to consider? Why might it be important? Because as you can imagine, without getting too nuanced with this, sometimes it may be effective, for example, with a client experiencing anxiety to rely on phone correspondence, whereas other times it may not be effective. If you don't know, some anxiety-related therapies are exposure-based, meaning that we tend to challenge the individual to approach things that make them anxious versus avoid. So again, that's a preference there, one of numerous preferences that can correlate with the modality to consider. And back to my initial points, the therapist style. I'll self-disclose here. I tend to be more, the style's called democratic, which is it's an in-between between laissez-faire and directive. I'm very collaborative, democratic style it's called, to and fro there. So some things to consider there. So time to find your fit. I like to say As I give credit to one of my old psychology professors, I'll never forget it. Anytime I see the word normal or slides like this, normal is only a setting on a kitchen appliance, right? So, in other words, there's no standard normal, right? It's subjective. Uh, there's 7 billion versions of normal on this planet, excuse me, or approaching 8 billion here. You get the gist. And frankly, why we say this, it's not far fetched for individuals maybe not to have the best match initially. This is no fault to anyone per se, right? BetterHelp's algorithms and member success team and powers that be do their absolute best to match you with therapists that are sufficient to your needs, but sometimes it doesn't work. And that's okay. I remind my clients and people I encounter that these are professional relationships. And a part of professionalism and general relationship endeavors involves learning the power of effective confrontation. I teach often on boundaries and communication in some of my course curricula. And I teach folks often if you confront well, your relationships will grow well also. This isn't necessarily all on you as a client or all on the therapist, but alas, if you're not feeling like it's a good fit, with all due respect, generally speaking, it may warrant a conversation. You do have the option with BetterHelp to switch therapists at any time. And should you so choose, you can most definitely do that. You have every right to. But prior to that, I do encourage individuals to do some self reflection. And should you feel obliged, have some conversation with your therapist. For instance, hey, I was really looking for some more art therapies, and I noticed that you do more behavioral therapy. Would it be okay if we discussed a transfer to a clinician that was certified in art therapy? Just back to some of those initial points we made. Yeah, let's talk about that, right? Let's help you in the transition. No harm, no foul. Other times, though, you'll find that match at the first go, right? It depends. I will say, admittedly, there's really no rhyme or reason to it. There is, given the parameters, I will say algorithmically, right, and how the BetterHelp system works. But alas, even those technologies can have their faux pas, if you will. No shade to the technology per se, but alas, it does what it can, right? It does its best matching on preferences, what have you. Hence why I encourage folks as prospective BetterHelp clientele using your perks here and memberships to be as descriptive as you can be in the questionnaires that you will be required to complete, which may involve things like a general blurb, what brings you to therapy, some questions, how often have you felt down, depressed, hopeless, have you felt nervous, anxious, on edge? And these questionnaire data are provided to us as available clinicians. So we get your whole questionnaire prior to accepting you as a client. Here's client A. Here's their main reason for seeking therapy. Here's what's going on with them. Here's some therapy preferences that they've mentioned. And if we feel it's a good fit, we can accept that, right? Or you can work with a therapist directly, should you feel obliged. So plenty of options there to support your needs and preferences, and a wonderful member success team that's working behind the scenes to assist you in therapy matching, which should you utilize your BetterHelp incentives, you'll learn more about how you can contact them if you need to, right? If you need to. So don't fret. A lot of people rage quit, as I call it, if you will, if I could be matter of fact, when understandably so. I'm not trying to be curt by saying that when their first go isn't the match that they prefer. That's all understandable because admittedly it takes a lot of gumption, if you will, to courageously initiate therapy. So I commend anyone here of whom's contemplative or perhaps already pursued it. That's stellar. That takes a lot of courage to do. Knowing how to ask for help is a sign of strength. And it makes sense why our disappointment may cause us to kind of throw our hands up in the air and say, forget it. I'm not going to try. But that doesn't help either, right? I gave it a valiant effort. Unfortunately, in the event I didn't find the right match. Unfortunately, it stinks. It's not what I preferred, but there's things I can do here in efforts to find the right fit for me. And normal is only a setting on a kitchen appliance. Some people like my style. Some people don't prefer my style, and that's fine. As you can see, I'm very candid, directive, matter of fact. Some prefer a therapist that's a bit more, I don't want to say soft, but for lack of better terms, a bit more laissez-faire, that term we used earlier, and that's fine. That's fine. So here's some things to ask potential therapists, some of which may not necessarily apply to your pursuits of therapy, but humor me here. I'll just speak more generalized with these payment modalities. That's apparently not something to worry about here with your incentives per se, but alas, in the general sense, if there's ever the potentials of needing to have this conversation, it's very important to talk. And I'm speaking generally here, not necessarily per your therapeutic endeavors here. Do the prospective therapists accept insurance? Are they do they accept self-pay only? Are they sliding scale, which means the technical term that a therapist can vary their fees for service based on the client's socioeconomic status, in layman's terms here. We talked about the second point thoroughly, but I'll reemphasize again, what type of therapy do you specialize in? It's a great question to ask a potential therapist. They will, and again, like I was nerding out about here a moment ago, and I'll nerd out a bit again here in a second. Therapists that are passionate about what they do, it shows, and they'll be excited to share with you their modalities they specialize in. I specialize in dialectical behavior therapy. We didn't talk about that today. It's a modified form of CBT. But I primarily specialize in that. Jennifer gave my whole spiel earlier. So again, thank you, Jennifer, for that. So, that's my specialty. That's what I have experience in. So that's what to be on the lookout for and to inquire, as many prospective clients do with me. Could you tell me a little bit more about your background? And also, I'm speaking for my what's called a member information form. It's also known as an informed consent form. I'm glad I thought of this because this is important. When you initiate care with your therapist, they'll send you over what's called a member information form, which is essentially what we use as therapists. It's called informed consent. It's a whole blurb or spiel about benefits and risks of counseling, the type of therapy that your provider provides, their availability, what to do in crisis situations, what we call duties to warn. That is when we, in ethical or legal situations where we have to break confidentiality. And again, those are trigger warning, self-directed violence, i.e. Suicidal ideation or attempts, homicidal ideation or attempt, child elder abuse or neglect, or forever court mandated to release information, are typically the parameters where we are obliged by law and ethics to break confidentiality. Thirdly, how will we monitor my progress? Stellar question to ask. Therapists use numerous parameters to gauge progress. This usually involves a compilation of objective measures and subjective measures. An objective measure would be like a questionnaire, what we call Likert scales. You're probably familiar with these if you go to a doctor's visits. You probably get some form of Likert scale. Over the last couple of weeks, how have your energy levels been? You'll get those with BetterHelp as well. They're called the GAD-7 and the PHQ-9. They're basically anxiety and depression questionnaires. Excuse me. Fourthly here, what modes of therapy do you use? This is similar to the second question. I specialize in DBT, but I use numerous models of therapy. Now, you do not necessarily have to be specialized in the therapy in order to use it. What that means is we have certifications or additional trainings. So a quick example that I can use art therapy as a licensed therapist. Ethically, I can do that, right? But obtaining a specialty enhances my expertise in it, if that makes sense. Right, so it's important to ask, what modes of therapy do you use? Individual, group, family. Again, to be clear, BetterHelp does not offer family therapies, unfortunately, but the parameters, again, that Jennifer had highlighted for you all. Peer groups, classes similar to the forum that we're in today, journaling, messaging, and individual sessions. Which leads to the next question. What will a session be like? I typically, when I'm meeting a client for the first time, will explain to them what the session will be like that day in follow-up sessions. Other therapists have different approaches. I'm very consistent in my approach because I'm of the ilk that most clientele that I meet they want some consistency in their lives, admittedly. And if I can provide consistency with a consistent expectation in session formats, that most definitely helps them. I've had numerous clients tell me that I like the fact that I know what to expect when I come into this session. Some therapists see it otherwise and like to throw curveballs and what have you, which it's not inherently wrong, but we have to be careful with that. Do you have a waiting list? This is another common one. We do get backed up sometimes as therapists, admittedly. There's an overarching need for mental health treatments. We are uh, communally, as a mental health and global and national community, even too, mind you, doing what we can to reduce barriers to treatments. Quick aside, there's really exciting legislation occurring called the Counseling Compact, if anyone's ever heard of it, which applies to mental health therapists, that allows for reciprocity across 40 plus states in the Interstate Compact. It's rolling out. So it's already started rolling out last year. So that's one example that's very excited about, as we could imagine, because it reduces barriers to treatment, because it essentially enhances more states and areas where we can practice. It's really cool. So we're going to see a substantial reduction in the bottlenecking, if you will, that we see now, and by proxy, a potential reduction in waiting lists. But alas, this is because there's an overarching need for therapy and not many therapists. There's more people becoming therapists now in the last 10 years, which is stellar, but still, things do bottleneck sometimes, especially if, I'll mention for myself, DBT is a bit of a niche treatment. And it's a big reason why I often bottleneck, because there's not many DBT providers. And so when there's supply and demand, essentially, if there's a lot of people wanting a modality and not many people offering the modality, it can bottleneck there by proxy. Some more potential questions here, and then we're going to have about 10, just looking at time here, about 10 minutes or so, and then we'll open up for Q&A. So hope you've been enjoying this. Hope to have some questions to address in our last 10 minutes. Some more questions here to ask. How much experience do you have treating my concerns? Again, a little redundant to that of the previous points, but one of my specialties too is anxiety, depression, mood, and personality disorder. That's my wheelhouse. I love treating those populations. I don't have as much experience in, say, eating disorder, or I think on the top of my head, neurodivergence or ADHD, autism. I just don't have as much. I can treat it, right? I'm trained to treat it. I just don't have as much experience as I do in anxiety, depression, mood, personality, and substance-related disorders. That's my wheelhouse. How long will therapy last? That's like the million-dollar question. One of which we as a therapeutic community have yet to come to a conclusive answer to, but admittedly, that's often the case with therapeutic communities. And why I love being a therapist is that we operate a lot in the gray. It depends how long therapy will last. Some people want to have brief therapy. Others want to be in therapy long term. Some mental health diagnoses may require the individual to be in session for a longer term, such as trauma and traumatic stress disorders. Those typically, not to be too generalized, take longer to treat, on average 2 to 5 years, respectively. What's your education and training? Most clinicians, or excuse me, I don't want to sound too aloof with that. All BetterHelp clinicians are trained at the master's or doctoral level. So rest assured, the clinician you'll be assigned to has at minimum a master's education, maximum doctoral or postdoctoral training and experience. I have master's level experience. I will eventually be going back to get my doctorate long term, but master's and doctoral level clinicians, of whom are trained very similarly. Doctoral levels are just more so, even more extensive niche specialty and dissertational work for some populace. How long is each section? With BetterHelp is 30 to 45 minutes, respectively, 45 minutes being the max. Some entities out in the general sense may offer 60 or even 90-minute sessions, but alas, BetterHelp offers 30 to 45, which I've found, I don't want to be too generalized here, is sufficient time. more than sufficient. Most therapy benefit, there's no conclusive evidence, by the way, that suggests that more therapy is essentially a good thing. It can be for supportive reasons, but that's more so outside of the scope of BetterHelp. We call that, where I used to come from, my previous line of work, intensive outpatient, known as IOP. Those modalities are a bit more, as the name implies, intensive. BetterHelp would be technically an outpatient, we would call that, meaning that you can come and go at your leisure and continue on with your life as you see fit here. Who's your ideal client? That's an interesting one. And I think it's a good one in the efforts to get to know your therapist a bit more. And I don't mean this to sound curt, what I'm about to say, but some clinicians are a bit more stoic, meaning they're indifferent and just kind of by the book. Others have a bit more charisma, flair. I tend to lean more so to the latter. I like to put a little charisma and flair on therapy. No shade to my colleagues or clinicians of whom are a bit more stoic. There's nothing wrong with that. But again, it comes back to those preferences. Some like a therapist that's a bit more charismatic. Others like one that's more stoic. Again, it's really preferential. But we have a forum with BetterHelp that fellow clinicians can collaborate about things. This is something that comes up a lot in our BetterHelp forums. The best way to approach sessions. So yes, even we as therapists kind of scratch our heads as to ideal approaches. We had an interesting thread recently, the type of attire that clinicians wear to sessions and why. So we even think about this a lot as clinicians. Also, trigger warning here. What happens if I'm in crisis? Do note, BetterHelp is not a crisis resource. But at the bottom of every BetterHelp page, if you need immediate access to crisis resources, you can tap or click, and it'll pop up crisis resources for your region and your area. And your therapist can assist you while navigating a crisis or potential crisis, while also helping refer you to crisis services in your region or virtually or systemically, I should say. But to be clear, BetterHelp is not a crisis resource, but your therapist can most definitely, in the event of a crisis, be a liaison in the event you encounter it. That saying, that expression, sometimes you just know, not to be too woo-woo with that, but there's truth to it. If you're feeling good with your therapist, if you feel, this is something I teach my supervisees, a good sign of a confident and skilled therapist is a clinician of whom is more conversational and less structural, if that makes sense. So if you feel like the conversation just flows, that your therapist gets you or is striving to get you, or you're impressed by their skill set and what they can offer you, right? This is typically like, okay, it's a good fit, right? You'll find it easier to talk to, be yourself. And moreover, that safety piece, which admittedly, with clients that are appropriate to use it, I use a lot of humor and joking. Some clients love that because that helps them to feel safe. Others may not like that, or it might not be appropriate to use humor. So rest assured, we as clinicians are trained as to whether or not to use humor and the clinical effectiveness of that. It's stuff that we have to think about a lot that the layperson might not initially consider. As we wrap here, so I'm just checking the time. I'm in between screens, so my time is blotted out on my monitor, so appreciate your understanding. Here's some red flags. While you may not have to worry about this with your BetterHelp clinician, as we do have a clinical ops team that ensures best practice and clinicians following standards of conduct. But here's some red flags you may encounter. I want to be very clear. We have a clinical ops team that oversees this. So it's unlikely you'll encounter this with a BetterHelp clinician, though I'll speak generally just so you're aware. You're not making any progress. I argue that therapy facilitates a process of change. It doesn't fix problems. So this isn't to say it's all on you or the therapist, but can be a great avenue to explore and talk about with your therapist. Why do I feel I'm not making progress? And by the way, though, again, I don't feel you'll have to worry about this with BetterHelp clinicians, but alas, just a generalization. Therapy is not to small talk and talk about niceties for 45 minutes. That can happen throughout the start or at the end of the session, but it should mostly be therapeutic and clinical. a progression towards your therapist will work with you in developing a treatment plan. The treatment plan essentially is what guides or pervades what you're doing in the session. Whether you're challenging negative thoughts, whether you're doing exposure therapies, whether you're doing narrative therapies. So a good therapist will tailor a treatment plan and check in with you regularly regarding that and inquire with you about your goals, if you want to modify them or what have you. And by the way, you have the autonomy on the general page, your general better health page, to create your own goals and review them with your therapist, and vice versa. Therapists can help you in the creation of goals too. So really neat. They lack professionalism and courtesy. We are held in high regard, understandably so, by our licensure boards and ethical boards, and also by our clinical ops teams at BetterHelp, understandably so. But if you ever feel a therapist is lacking professionalism and courtesy, and this can be a wide array of facets: saying inappropriate things in session, being discourteous, being aloof and showing up to sessions, or missing sessions entirely. While these things unfortunately do happen periodically, if they're consistently happening, that's a lack of professionalism. And of course, you have every right to report that. I encourage clients, report that to, if it ever happens, to the BetterHelp personnel, so that appropriate personnel can intervene and assess the situation. You're censoring yourself, your gut says no, or again, they're inappropriate and unethical. If you feel unsafe or feel like you have to censor yourself, just pay attention to that. Why do I feel I can't be courteous and genuine and honest with my therapist, and why? And as I alluded to earlier, for sake of time, we'll touch on these a little bit. If you don't think it's a good fit, don't be afraid to end things. Keep it simple and direct, and let your therapist know you decide to go in a different direction. It's a variant of "it's not you, it's me," as they say. It's not you, it's me. Excuse me. So just be direct and clear. Do note you can change at any time, but I would recommend attempting to have a conversation with your therapist in hopes that you can gain more clarity as to an appropriate direction. And I believe this is our next to last point, or last point here. You have to forgive me, I don't have my overview in front of me here. Don't be afraid to start over. I alluded to this earlier. It makes sense why you want to throw your hands up and because it takes a lot of effort. It does. You get the work up to doing the questionnaire, and you're assigned a therapist, and darn, in the worst case scenario, they're not a good fit. Right? But you can read here, you're better off starting over than continuing something that no longer serves you. It is easier to quit therapy, but if you don't mind me reading here, when you give yourself a chance to find the right therapist, you can experience lasting change and, moreover, more life satisfaction, which can benefit you well beyond therapy's end, whenever that end might be for you. So again, don't be afraid to start over. All righty, so we are out of time for today. So I'll pass it over here to Jennifer. And again, if you've yet to submit a question, Jennifer has the anonymous QA link, which we'll be referencing now, or feel free to hop on the chat pod if you want to ask me a question directly. But I'll pass it over to Jennifer here. And yes, thank you all for listening attentively. I hope this was beneficial for you.
Okay, that was great, Corey. It's beneficial for me as well. But if anyone has any questions, you can feel free to come off of mute, turn your camera on. That would be great. But I do have a couple of questions that were submitted. One being, if you do switch to a different therapist, are the notes transferred over?
Good question. I don't think they are, but that is a question that would be best suited, I believe, for our member success teams. So I don't believe they are, but I'm fairly confident that they aren't, because that would breach HIPAA and confidentiality. So no, they're not.
Okay, good to know. And then the other question is, would you also recommend this for managers to discuss in their sessions, like communication issues with their employees?
Stellar question. In regards to seeking therapy?
No, like as far as like, I'm having this issue with my employee, how would I address it? Yeah.
Oh, okay. So more so like conflict resolution. So yes, some of those strategies we looked at in regards to if you don't feel a good fit with your therapist, yes, can also be applied in managerial related endeavors, team related endeavors. With subtle plug, I do a class on boundaries and work related conflicts too, where we touch on that. And I'll share it here to the question. Confront well and your relationships grow well also. I get it. None of us like to confront. I'm a darn therapist and I don't like to confront people, but it's a part of growing in the therapeutic sense, professional relationship, and in the personal sense, personal relationships, vocationally even too. Hey, I don't feel like we're seeing the same page on this. This is what I'd like to see moving forward, but I'm open to hearing your feedback. Thank you for consideration and again, that compromising language here.
That's great. And his classes, I will say, Corey, his classes are wonderful. So if you want to check him out on our platform, please do. And if you can't attend at the time that it's being offered, a recording will be sent to you afterwards. So it's great. Are there any other questions? All right. I did put a link in there as well for a feedback, if you could take a few minutes to submit that. But otherwise, thank you all for your time today. We appreciate it.